Question 1. A nurse is assessing a client with suspected peptic ulcer disease. Which symptom requires immediate intervention? A. Epigastric pain relieved by eating. B. Hematemesis and black tarry stools. C. Intermittent nausea after meals. D. Bloating and belching after fatty foods. Answer: B. Hematemesis and black tarry stools. Question 2. A client is admitted with suspected bowel obstruction. Which finding requires the most immediate action? A. Absent bowel sounds and abdominal distension. B. Mild cramping pain and nausea. C. Intermittent episodes of diarrhea. D. Increased bowel sounds with gurgling noises. Answer: A. Absent bowel sounds and abdominal distension. Quarter 3. A nurse is teaching a client with gastroesophageal reflux disease, GERD, about dietary modifications. Which statement by the client requires further teaching? A. I will avoid caffeine and spicy foods. B. I should elevate the head of my bed while sleeping. C. I can have a bedtime snack to prevent acid buildup overnight. D. I should eat small, frequent meals instead of large meals. Answer: C. I can have a bedtime snack to prevent acid buildup overnight. Quarter 4. A client with cirrhosis has ascites. Which nursing intervention is most important? A. Encourage a high-protein diet. B. Monitor daily weights and abdominal girth. C. Increase fluid intake to prevent dehydration. D. Position the client flat to prevent hypotension. Answer: B. Monitor daily weights and abdominal girth. Question 5. A nurse is assessing a client with suspected appendicitis. Which finding requires immediate intervention? A. Right lower quadrant pain. B. Nausea and vomiting. C. Sudden relief of pain followed by rigidity. D. Low-grade fever. Answer: C. Sudden relief of pain followed by rigidity. Question 6. A nurse is preparing to administer lactulose to a client with hepatic encephalopathy. Which finding indicates the medication is effective? A. Decreased episodes of diarrhea. B. Reduced ammonia levels. C. Increased appetite and energy. D. Improved hemoglobin levels. Answer: B. Reduced ammonia levels. Question 7. A client with Crohn's disease is experiencing severe diarrhea. Which electrolyte imbalance is the priority concern? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hyponatremia. Answer: B. Hypokalemia. Q8. A nurse is caring for a client with an NG tube for gastric decompression. Which assessment requires immediate intervention? A. The client complains of thirst and dry mouth. B. The tube is draining greenish fluid with no odor. C. The client's abdomen is distended and firm. D. The suction is set to low intermittent suction. Answer: C. The client's abdomen is distended and firm. Question 9. A client with ulcerative colitis is experiencing an exacerbation. Which dietary choice requires further teaching? A. Baked chicken and white rice. Breakfast oatmeal with fresh berries. C. Scrambled eggs and white toast. D. Plain pasta with olive oil. Answer: B. Oatmeal with fresh berries. Q10. A nurse is caring for a client with esophageal varices. Which intervention is the highest priority? A. Administering a proton pump inhibitor. B. Monitoring for signs of bleeding. C. Encouraging a high-fiber diet. D. Providing frequent oral hygiene. Answer: B. Monitoring for signs of bleeding. Q11. A nurse is evaluating a client post-endoscopy. Which assessment finding requires immediate action? A. Mild throat discomfort. B. Absent gag reflex 30 minutes post-procedure. C. Slight bloating and belching. D. Drowsiness from sedation. Answer: B. Absent gag reflex 30 minutes post-procedure. Q12. A nurse is providing discharge teaching to a client with diverticulitis. Which statement by the client requires further education? A. I should increase my fiber intake once the inflammation resolves. B. I will take my antibiotics as prescribed. C. I will avoid seeds and nuts to prevent complications. D. I can take ibuprofen for pain management. Answer: D. I can take ibuprofen for pain management. Q13. A client with suspected cholecystitis is undergoing assessment. Which symptom supports the diagnosis? A dull pain in the left lower quadrant. Bilateral right upper quadrant pain radiating to the shoulder. C. Burning epigastric pain relieved with food. D. Sudden periumbilical pain that shifts to the right lower quadrant. Answer: B. Right upper quadrant pain radiating to the shoulder. Q14. A client with pancreatitis is receiving total parenteral nutrition, TPN. Which finding requires immediate intervention? A. Capillary blood glucose of 250 milligrams per deciliter. B. Mild nausea and bloating. C. Serum albumin level of 3.2 grams per deciliter. D. Slight redness at the IV insertion site. Answer: A. Capillary blood glucose of 250 milligrams per deciliter. Q15. A nurse is assessing a client with suspected peritonitis. Which finding is most concerning? A. Board-like abdominal rigidity. B. Mild rebound tenderness. C. Temperature of 99 degrees Fahrenheit, 37.2 degrees Celsius. D. Decreased bowel sounds. Answer: A. Board-like abdominal rigidity. Q16. A client is receiving metoclopramide for nausea. Which adverse effects should the nurse report immediately? A. Drowsiness. B. Dry mouth. C. Lip smacking and facial twitching. D. Increased appetite. Answer: C. Lip smacking and facial twitching. Q17. A nurse is caring for a client post-gastrectomy. Which complication requires immediate intervention? A. Dizziness and sweating 30 minutes after eating. B. Mild abdominal bloating after meals. C. Decreased bowel sounds in the lower quadrants. D. Mild nausea relieved by rest. Answer: A. Dizziness and sweating 30 minutes after eating. Q18. A client with hepatitis B asks how the disease is transmitted. Which statement by the nurse is correct? A. Hepatitis B is transmitted through contaminated food or water. B. It spreads through airborne droplets from an infected person. C. You can contract it from unprotected sex or sharing needles. D. It is only spread through blood transfusions. Answer: C. You can contract it from unprotected sex or sharing needles. Q19. A nurse is assessing a client with a small bowel obstruction. Which finding requires immediate action? A. Crampy abdominal pain and vomiting. B. Increased peristalsis and hyperactive bowel sounds. C. Sudden decrease in pain and absent bowel sounds. D. Abdominal distension and bloating. Answer: C. Sudden decrease in pain and absent bowel sounds. Q20. A client is being discharged after a hemorrhoidectomy. Which instruction is most important? A. Avoid sitting for prolonged periods. B. Use warm sitz baths for comfort. C. Take prescribed stool softeners. D. Report increased pain or bleeding immediately. Answer: D. Report increased pain or bleeding immediately. Q21. A client with a history of chronic alcohol use is admitted with suspected acute pancreatitis. Which finding requires immediate intervention? A. Severe constant epigastric pain radiating to the back. B. Elevated serum amylase and lipase levels. C. Respiratory rate of 32 breaths per minute and PaO2 of 88%. D. Nausea and vomiting for the past 24 hours. Answer: C. Respiratory rate of 32 breaths per minute and PaO2 of 88%. Q22. A nurse is caring for a client with acute cholecystitis. Which food selection by the client requires correction? A. Grilled chicken breast with steamed vegetables. B. Baked salmon with a side salad. C. Fried chicken with mashed potatoes and gravy. D. Oatmeal with bananas and honey. Answer: C. Fried chicken with mashed potatoes and gravy. Q23. A client with suspected gastric cancer is scheduled for a barium swallow study. Which pre-procedure instruction should the nurse provide? A. You must avoid eating or drinking after midnight. B. You will receive sedation before the procedure. C. You should avoid taking your medications on the day of the test. D. You will need to remain on bed rest for 24 hours after the procedure. Answer: A. You must avoid eating or drinking after midnight. Q24. A nurse is teaching a client with Barrett's esophagus about lifestyle modifications. Which statement indicates a need for further teaching? A. I should avoid spicy foods and caffeine. B. I will elevate the head of my bed while sleeping. C. I should take my proton pump inhibitor before meals. D. I can drink a glass of wine with dinner to aid digestion. Answer. D. I can drink a glass of wine with dinner to aid digestion. Q25. A nurse is reviewing the medication list for a client with peptic ulcer disease. Which medication requires clarification with the provider? A. Omeprazole. B. Naproxen. C. Sucralfate. D. Ranitidine. Answer. B. Naproxen. Q26. A client with liver cirrhosis is at risk for hepatic encephalopathy. Which intervention is the highest priority? A. Encourage high protein intake. B. Monitor ammonia levels and mental status. C. Administer iron supplements for anemia. D. Provide sodium-rich foods to prevent fluid loss. Answer. B. Monitor ammonia levels and mental status. Q27. A nurse is caring for a client with a new colostomy. Which statement by the client indicates appropriate understanding of colostomy care? A. I should use alcohol wipes to clean around the stoma. B. I will change my colostomy pouch every day. C. I should empty my pouch when it is 1/3 full. D. I should avoid drinking too much water. Answer. C. I should empty my pouch when it is 1/3 full. Q28. A client with gastroesophageal reflux disease, GERD, is prescribed pantoprazole. Which statement by the client requires follow-up? A. I will take this medication before breakfast each morning. B. I should avoid drinking carbonated beverages. C. I can take this medication whenever I feel heartburn coming on. D. I should continue taking this medication even if I feel better. Answer. C. I can take this medication whenever I feel heartburn coming on. Q29. A nurse is assessing a client who underwent an abdominal paracentesis. Which finding is most concerning? A. Blood pressure of 88/50 millimeters of mercury. B. Mild abdominal discomfort. C. Decreased urine output. D. Clear yellow fluid drainage at the site. Answer. A. Blood pressure of 88/50 millimeters of mercury. Q30. A client with an upper gastrointestinal bleed is receiving an IV proton pump inhibitor. Which assessment finding indicates a worsening condition? A. Coffee ground emesis, black, dark, tarry stools. C. Blood pressure of 85/45 millimeters of mercury and tachycardia. D. Hemoglobin level of 12 grams per deciliter. Answer. C. Blood pressure of 85/45 millimeters of mercury and tachycardia. Q31. A nurse is caring for a client with a nasogastric NG tube following gastric surgery. Which action should the nurse avoid? A. Measuring NG tube output. B. Flushing the NG tube with normal saline. C. Repositioning the client to prevent aspiration. D. Irrigating the tube with tap water if it becomes clogged. Answer. D. Irrigating the tube with tap water if it becomes clogged. Q32. A client with ulcerative colitis is prescribed prednisone. Which instruction is most important? A. Take the medication with food. B. Do not stop taking this medication suddenly. C. You may experience weight loss while taking this medication. D. Avoid exposure to sunlight. Answer. B. Do not stop taking this medication suddenly. Q33. A client with suspected celiac disease is undergoing diagnostic testing. Which dietary habit supports the diagnosis? A. Consuming wheat-based cereals daily. B. Eating a high-protein diet. C. Avoiding dairy products. D. Drinking carbonated beverages. Answer. A. Consuming wheat-based cereals daily. Q34. A nurse is teaching a client with dumping syndrome about dietary modifications. Which statement indicates correct understanding? A. I should eat large meals to maintain my energy. B. I will lie down for 30 minutes after meals. C. I should drink fluids with my meals to aid digestion. D. I should avoid protein-rich foods. Answer. B. I will lie down for 30 minutes after meals. Q35. A nurse is monitoring a client with an ileostomy. Which finding requires immediate intervention? A. Liquid stool output of 600 milliliters per day. B. Stoma that is pink and moist. C. Skin irritation around the stoma. D. Stoma that is dark and dusky. Answer: D. Stoma that is dark and dusky. Q36. A nurse is reviewing post-procedure care for a client who underwent a sigmoidoscopy. Which instruction is most important? A. You may experience slight rectal bleeding for a few days. B. Avoid drinking fluids for at least 6 hours. C. Notify your provider if you develop severe abdominal pain. D. You may resume a normal diet immediately. Answer: C. Notify your provider if you develop severe abdominal pain. Q37. A client with a history of GERD is experiencing increased symptoms. Which factor is most likely contributing to the client's worsening condition? A. Sleeping with the head of the bed elevated. B. Drinking herbal tea with meals. C. Taking ibuprofen daily for arthritis pain. D. Eating 6 small meals per day. Answer: C. Taking ibuprofen daily for arthritis pain. Q38. A nurse is providing dietary education to a client with chronic pancreatitis. Which food choice requires correction? A. Grilled salmon with steamed broccoli. B. Fried shrimp with French fries. C. Scrambled eggs with whole wheat toast. D. Brown rice with grilled chicken. Answer: B. Fried shrimp with French fries. Q39. A nurse is caring for a client with suspected peritonitis. Which lab result is most concerning? A. White blood cell count of 18,000 per millimeter cubed. B. Hematocrit of 40%. C. Albumin level of 3.5 grams per deciliter. D. Serum potassium of 4.0 milliequivalents per liter. Answer: A. White blood cell count of 18,000 per cubic millimeter. Q40. A nurse is educating a client about preventing gallstone formation. Which recommendation is most appropriate? A. Increase your intake of high-fat foods. B. Maintain a healthy weight and engage in regular exercise. C. Avoid eating foods high in fiber. D. Drink large amounts of water with meals. Answer: B. Maintain a healthy weight and engage in regular exercise.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.